I'm Patricia Hesnan. I'd like to introduce you to a method or a technique for working with babies who may be distressed or in pain. This technique is called energy therapy. Numerous people ring us here at our centre on a daily basis sometimes to ask, what can I do about my child? They're not sleeping, they're not eating, they're crying day and night. Now, energy therapy can be applied to a baby, it can be applied to anyone. We all have the ability to apply energy therapy. Energy can be directed from one hand to the other, from the palm of one hand to the palm of the other. So to apply this therapy, what you do is you stimulate the energy between your own two hands. And when you feel your hands getting slightly warm, you can move them apart very gently, 3 to 5 inches, and you may feel a pulse, you may feel heat, you may feel a tingling sensation. Now, once you've done this, you're now ready to apply energy therapy to your baby. So remember, everybody has an energy field. There's 7 main chakras in the energy field. So there's the root or base chakra, the sacral, the solar plexus, the heart, the throat, the third eye, and the crown. So we're going to apply energy therapy to the base chakra of this baby. Now, the reason for this is when a baby has experienced any sort of shock or trauma, either pre-birth or during birth, the base chakra or root chakra can be affected. So this baby was in a minor car crash when its mother was about 6 months pregnant. The baby has a very high startle reflex. A door bangs, somebody sneezes, the baby's awake and screaming. We'll take this baby for example. This is the reason we're going to use this particular technique. You can do this with your own child. It saves travelling, it saves cost. It's what you can do. This baby has been cleared medically. There is no medical reason for this baby's constant screaming. So what we're going to do is apply root chakra energy clearing to this baby. What you do first is you place your right hand underneath the baby's sacrum. You hold the left leg quite tightly, but not restricting the blood supply of the left leg. Then you move your left hand above the baby's crown chakra. You're now sending a flow of energy from your right hand to your left hand, up along the baby's spine, up along the back of the baby's head, up through the cranial bones, and out through the crown chakra. Sometimes when you're actually doing this particular energy flow, the baby may begin to wriggle and twist and bend and start to rotate its body backwards and forward. Allow it to do this, but don't let go of the left leg, because the baby may swivel and flick itself off the table. So the baby needs to be held in that position. Now you move your hand over the baby's head, and in an anti-clockwise movement, you now are clearing the crown chakra. Sometimes it's beneficial to know what is in each chakra. There's a CD on our site that explains what emotions are in each chakra and the different levels of the emotions. Then, after 3 to 5 minutes, you move your hand down and directly over your right hand, you do an anti-clockwise movement with your left hand for 3 to 5 minutes. You will feel the energy between your two hands. Now you can go back up again to the head, and sometimes you'll feel a heaviness in the energy field. Sometimes it can feel sticky. You can flick your fingers. Now, if the baby gets restless, sometimes the baby doesn't like this, try and reassure the baby, but try and finish the session. It could take a half an hour. We have worked on babies, for 2 of us, for a full hour. Sometimes even bringing a little toy for the baby to play with. Be careful that yourself, the person that's doing the therapy, you don't have any long earrings, because the baby will catch a glimpse of it and wriggle towards you and try to pull it out. So now you continue the session, okay, do a little bit of clearing again, and you finish the session. You take your hand gently out. Now the baby could be asleep at this point. Take the hand out, the right hand out, and hold the right and the left foot for 3 to 5 minutes. Now remember, if it's somebody else that's doing the session and the mother is unable to do the session, or the father, whoever's with the child, and you've got permission, you must seek permission to do any sort of therapy on another person's child. Make sure that the baby can see, the first thing the baby sees and the first person the baby sees is an image of the parent or guardian or whoever is looking after the child. So, or the baby sees its own teddy, anything that the baby can feel reassured that it's in its own comfortable space. You won't do any harm doing this therapy. You will not do any harm. As again, always ensure that the baby has been medically checked for these pains or cramps or this distress, and you can do a lot of good. A particular lady came to me one time and she said, why aren't we all taught this when our babies are born? That they don't get to the stage in life that they're crippled with fear, and all this memories, all this baggage is carried in their energy field. So if you feel you can do a little early on, it can prevent something major later on. So I'll show you now how this is a table. It's an ordinary dining room table. What I've got here is a big long draft excluder. I put it on a towel and then I put the sheet on top of it. So it's on the towel so the draft excluder doesn't roll. And I've got another one here on this side. So the towel went on first, 2 draft excluders, a little cushion here. Now it may be advisable to put a little towel under the baby's head, because sometimes the baby will get sick during therapy. So it could be stuff that it's thrown up, that it's caught in its digestive system. So just be aware of that. If the baby needs to be covered over, if the baby's, make sure the room is warm enough. If the baby needs to be covered over, if it's its own little blanket, that's fine. That's fine, whatever way the baby's comfortable. Now, as you can see, this is a dining room table. If you are working with the baby, you can pull this whole thing much closer to you, so that the baby is within the view of the mother or father or whoever's working, a clear view. Because if you push the baby way over there, they're going to keep turning to look at you. So good luck with all of that. And if you have any queries or any questions, feel free to send us an email. Thank you for watching.